Welcome, colleagues, peers, rehab professionals. The time has come to complete service learning on, or to start service learning on mental health awareness. A few months back, within the department, I made an announcement that I was looking forward to doing something for mental health awareness in the mom race. So in order to tie that all in, we're going to have a few activities to promote community awareness within the department and with the race, and we're also going to have a series of PowerPoints, presentations for education. So this is my introductory presentation. Once this video is done, there will be a PowerPoint to follow. Hopefully you guys will have the opportunity to, or take the opportunity to listen and just have a better idea of what's going to be coming in the upcoming weeks with mental health awareness. A few points I want to bring up are May 4th is the mom walk, the mom race. We've had several people volunteer in the past. Hopefully that continues. The website is already open. If you guys need help with that or are looking to get the early bird fee on that one, feel free to look on it quite quickly, because I think the early bird registration is only now through March, and then you pay a higher fee. Within the department, we will be attempting to do a donation fund for what we would call a wall of honor, and that's going to go on a t-shirt. We'll get more details on that in the upcoming weeks. And then there's also the t-shirt itself, where you can purchase it, and that will kind of be a community awareness promotion in and of itself. You know, you wear the t-shirt, it kind of brings an awareness to mental health and rehab services. So we have a multifaceted approach with this year, and hopefully it's going to be fun and enjoyable, and also a great learning experience. The service learning is going to involve 4 videos of PowerPoint presentations through YouTube. So hopefully the staff watching can have access to it at any point, but I would hope that we'd have opportunities during our staff meeting to watch these videos and to maybe drum up some discussion amongst ourselves or whoever we're watching the video with, just to encourage each other to be more vocal and talk about some ideas as to how we as healthcare providers, rehab professionals, can influence a special community, the mental health community, within our scope of practice. Mental health awareness, part 1 of 4, the role of rehab professionals, the introduction. The purpose of this 4-part series is to bring about awareness to rehabilitation professionals of the role that we can play in becoming a more integral part within the mental health community. The objectives: to present mental health in a format that may enhance the client-patient outcomes within rehab. To bring about an awareness of clinically and non-clinically diagnosed mental health issues which can benefit from rehab service. To recognize the benefit of exercise in patients with common mental health diagnosis. To become aware of the stigma and support required with mental health crises in our community. To become a supporter of mental health through learning, volunteering, and representing within our community. This slide shows a significant percentage of people not receiving treatment after a major depressive episode. In America, 16.2 million adults had at least one major depressive episode, and of those, 37% did not receive treatment. More strikingly is the children between the adolescents between ages 12 and 17 had an episode, and 60% did not receive treatment.
Those numbers are pretty astronomical. Many of us have probably already seen commercials on TV for speaking up, public service announcements on the radio and TV, broadcasts from athletes or celebrities that discuss their depressive disorders. Frequently we see athletes or even celebrities end up passing away due to suicide because their mental health problems were not addressed or not addressed appropriately, or they just did not find the right help at the right time. So what I'm hoping to do with this presentation is to encourage a safe area for our patients to feel as if they can express themselves, so we can direct them to the correct place, or we can better help them manage, depending on their diagnoses, through exercise and rehab to help them cope with any of their symptomology. So this brings us to how we as rehab professionals, and within our scope, what can we do? I pulled out a few snippets from the OT scope of practice, and it specifically states to promote health and wellness to an at-risk population for illness, injury, disease, or disorder. And they also mention addressing the physical, psychosocial, and sensory and other aspects to engage support in life activities that affect health, well-being, and quality of life. And as far as physical therapy scope of practice, there is the basic behavioral and clinical sciences, which we study, and that practice includes contributions to public health services aimed at improving population health and human experience. So as you can see, both PT and OT can play an integral role in mental health throughout the community within our patient population with the tools that we have. Now, in my review of some of the research, I came across this article through the European Union, where they actually have a physical therapist mental health organization as well as a psychiatric association in Europe, and they have collaborated with research that definitely shows physical activity as a treatment for severe mental illness. And what do we do as rehabilitation professionals? We encourage physical activity. So now you're starting to see how some aspect within our scope of practice will definitely tie in to mental health illnesses. In the upcoming weeks, I'm going to have 3 more presentations. The first one's going to involve clinically diagnosed and non-clinically diagnosed disorders, which we may come across through our clinical practice. A second one will be how exercise can affect some of these mental health disorders and assist in improving quality of life. And the third one is a health promotion, which I introduced within that video. We're looking to incorporate some volunteerism, some community awareness through a few activities, so more of being an active participant versus a passive participant.